Today's May 15th, 2024, and welcome to the City of Laredo Living Committee for People with Disabilities. And the first, I'd like to coordinate it over, and the first item is the approval of minutes for April 17th. You should have them on your folder as well. So you want to take a look at those? Is it? So who did it, who did we owe we have minutes here today.
She's your secretary?
So she came through.
She's on, was she coming to yours? Yes, they're there. Yeah, I was here.
Hear you.
Is this a correct April 17th? I was there.
Are you in there? Yeah, I'm not here, but I was.
Oh, yeah, that's correction. Well, these are at the auditorium, right? Or she put missing some people, so maybe. Yeah.
So were there any additions or corrections we need to make?
Yes, on the president, it was myself,
On that.
and then
Myself.
Jackie también. Who else was there? Jackie, who was that?
So me and Jackie were here.
Yeah.
Okay. Okay.
Thank you. Is everyone signed it?
No.
Yes, so nice. I'm charging. In the business.
Just a bit.
Nice.
10 minutes.
Oh, nice, okay.
Looks good to me. Any corrections or additions to the actual material, the actual minutes? No.
They look good to me.
There's only one correction, that would be number 4, under Christine Reyes, she put in, there was an M, so why the M is there?
Oh, okay.
Okay. So, and somebody to move to approve minutes.
I move to a
Second, thank you both. So the minutes were approved for April 17, 2024. And the next item of discussion is discussion with possible action regarding update on membership committee and engagement. Do we have that? Okay. Do we have a roster? No, I'm not gonna, then I don't need a roster, I'm just gonna talk. Okay. I don't have the actual roster with me right now, okay, but there's been a number of times that some of us have not shown up to the meetings consistently or for a while, okay? And if I go by the letter of the rules or policy of the city council, I think you're allowed 3 absences a year or something like that, okay? But so, all I'm asking is that if you're not gonna make it, you let us know, or you can just connect via phone, okay? So we can still count that you're present, okay? But I don't wanna have to go to the city, the mayor's office, or the mayor, and let them know that I've got some memberships who don't have consistently failed to show up. you're important, you are representing organizations that provide vital services to the city and the populations that we serve. So I'm sure you have a whole lot more to contribute. And so all I ask is that, you take that into consideration. When you're sitting there on Wednesday morning deciding whether you're gonna come or not.
And if I may interject or add to that, so there is an ordinance that allows only 3 absences from committee meetings. Fortunately or unfortunately, it has not been enforced by our legal and city secretary's department. Not to say that, tomorrow city council will revisit the item, will want to monitor, right, retroactively the attendance. We do submit a report for the committee twice a year, so every January and every July. We report, part of that report is all your minutes, all the agendas, any other supplemental materials, but it does include an attendance report. So they do have it documented, and it's just a matter of them kind of scrutinizing it, and then if action comes from council or one of those departments, then we would have to abide by any of that instruction. So we understand, there's conflicting priorities. You guys are very, very busy. You do very, very great work in our community, but we just want to kind of get the message out kind of preemptively in the event that it does arise as an item of concern. I can go ahead and reshare the ordinance with y'all, so you guys can see kind of how it's documented. We got additional messages from the Governor's Committee for People with Disabilities on, they wanted some feedback. We shared a survey with y'all yesterday. They just sent me another email this morning about the priorities of the committee for any type of a policy that might be up for support in the legislative session. So it's really looking like we can elevate the work that you guys have been doing for many, many years, and that we can bridge that at the state level. So I would definitely, personally, I would want us to have a seat at the table, for the Laredo community, and that would be with the help of you all. So we'll keep sending the messages that we receive from the Governor's Committee. Another note I wanted to make is you guys are mayor appointed, so it's unlike other committees where you guys have, terms or you're designated by a particular council member. So it is a little different. I know at one point you guys were visiting, the idea of like bylaws or some sort of charter for your particular committee. That's not to say, you couldn't expand on that or revisit that. But just kind of wanted to put it out there. So in the event notifications do come from up above, we kind of had already the conversation with the members.
So there is an ordinance for this, and you're gonna be sending it to us.
Yes, there is an ordinance.
In the ordinance, do we have a mission and a vision statement and all of that? What is the objective? Because I was appointed just recently, and I would have liked to have gotten, okay, here we go, Mrs. Orduño, this is the objectives for the Blue Ribbon Committee. Because I've been coming for like maybe a year, and some of these agendas are very tiny, and it's been Autism Coalition and Autism, the surveillance, and that was it. And I get out of here saying, but this is me. And I get out of here saying, okay, so what did we accomplish?
Yeah.
So to me, this is me as a teacher, this is me as a board member now telling you, to me, it could have been an email. You get it? So I think when you say we need to elevate this, I'm new, but definitely we need to make ourselves more visible out there. The mere fact that we never have any public comments, it should be a red flag, because there's a lot of needs out there. there's lots of needs for our community with disabilities. And just the mere fact that we never have a public comment, it's like, okay, what's happening? Either it's not getting out there, people don't know that we're out there. I didn't know we were out there, until the mayor approached me and I was like, yeah, let's make a difference. Because I think that's what we're here for, but I believe we need to elevate it a little bit more and definitely meet and try to meet with an agenda that's going to have other things. And this agenda looks pretty cool compared to the ones that we have been a few months ago, just this and this and that's it, and this and this and that's it.
Which is true, that's your question.
Not a question, a comment.
No, that's fine. And you're absolutely right, and you're entitled to your opinion, and, I respect your opinion, because in many ways I agree with a lot of what you've said. Okay, so on that question of terminology, what you did ask, what was the mission, what do we do here? And primarily, the committee is set up to provide information or assistance to the mayor. Okay, and we use this as feelers around the community to find out what are the needs of the individuals within the community that have disabilities that the city could address. And so that's primarily, okay, we are an extension of the mayor's office in that sense. And so we provide information to the mayor, data, assistance, everything, because the room is filled with people who have specialties within different areas of disabilities, whether they're intellectual or physical. And so that's primarily our mission, is to serve the mayor's office and whatever his concerns may be or questions that may come. We also
Mr. Chair,
Yes.
Mr. Chair, I can read the mission statement. I have it here.
Okay.
It says, mission statement to serve as advocates for those in our community with disabilities by promoting awareness, education, and securing resources for their physiological, psychological, and social well-being. As the Blue Ribbon Committee, we also have the responsibility to provide guidance and service consultants to the City of Laredo officials regarding issues affecting people with disabilities. It goes on, but that's the mission statement.
And that is posted in the city secretary's website under all of the boards and commissions and committees. So the mission and vision is as established by the committee back in 2010. It has been there. And then the ordinance that I was speaking on is a general ordinance on all committee, commissions, and boards for the city of Laredo. It's not specific to the Blue Ribbon Committee for people with disabilities, but it just kind of gives some parameters or some expectations from council and city officials on their expectations on the various committees. So I will reshare that with y'all.
And on my behalf, I want to apologize to you, okay, if we didn't provide you with, I guess when we go into an organization, you provide them, or a committee, provide them with an introduction and information.
No need to apologize.
So it wasn't their fault.
No, it's no one's fault. I'm not blaming anybody.
I tell you, when you came on board, okay, you have a reputation for knowing when you go in, okay? And so my experience, okay, was that Ms. Rodriguez knows everything about us already, okay? That was,
I make it up.
and so it was my error, or our error, to maybe that when we ever have a new member, we need to introduce him to what is it, or her, what is it that we do in training, and just keep them at least informed. That was our mistake, because Ms. Rodriguez, you came in and we were like, okay, she knows her stuff, okay, nos va a educar a nosotros, so don't everybody. And I'm being like real sincere with you on that.
Appreciate it, but there's no need to apologize. I just, one thing you all know is I'm extremely outspoken and I do want to make a difference. My passion is there. Like everybody else in this room, I see the passion. And I think we could just do a little bit more.
Sure, we can.
A lot more. With all of us coming together.
And that brings me to the, were you gonna say something, Dr. Withinger?
No, I'm listening. Good conversation.
Yeah, I'm gonna beat up, but that's cool.
In regards to the comments, I've had clients in the past where they say like, hey, who can I go talk to about some of the issues so they have to say already? And one of the things that they come across is that it says that citizens are required to notify members of the intent to make their comment, right? But when they try, they say, I can't get through to anyone to let them know that I want to be present. Like, do I just show up or are they going to turn them away?
They can just show up. It's a public meeting, and it's posted in our website as well. It's with Miss Angie. And these are posted, right? These are posted as well at City Hall.
But they don't need to schedule that they're gonna be here.
No, they just show, because it's public.
You know, 10 people they show up right now and say, I wanna speak.
Yeah.
And we need to let them speak at least for 30 minutes.
Yeah.
Okay? I don't know how strict we are, but in most organizations, you need, your public comment has to be based on something that's on the agenda, okay? Because now you've got all kinds of people walking in and talking about any topic, okay, that has nothing to do with what's on the agenda, and so it would be very difficult to manage and control. I mean, particularly we don't put parameters or boundaries on that, but if people have something to say, or they want to complain, or they want to voice their needs without hesitation, that's what we're here for.
And then as far as after they submit their concern, what is the role of this committee to be able to assist them? Let's say they have a concern with Park and Recreation, or they have a concern with the Laredo Housing Authority. Like, how much will this committee assist the individual other than just listening to them?
Remember that you go down the table, everyone represents a different organization or different discipline or different disability, okay, whether it's intellectual, behavioral, etc., okay? And so there's no likely that one of us is going to know what to do with that issue, okay? And so it starts there with us providing that information to them. And then if they need advocacy or they need someone to step in and help them access that care, that department or that organization, we can probably do it more successfully than the average person because people know what we do, okay? We go under the umbrella of the City of Laredo Individuals with Disabilities. And so, yes, I think you would get more attention than if you try to barge into someplace on your own, okay? And so I think that's where the advocacy part comes in, that we're in a position of, I don't want to say a power, but we have the authorization and the oversight of the mayor or the city of Laredo. And so when we walk into any organization, we can, that's who we are, that's who we represent.
Now, if somebody submits like a prior concern, like somebody that we know, like they know us from the outside world or within our agency, sometimes we can even bring it to the committee beforehand and say, hey, so-and-so, like I want to say some months ago, we had a previous customer of VR voicing his concern of a MetroLift services, that there wasn't a lot of vans available. So I was able to share that information, and by that next meeting, we had somebody from El Metro come in and give a presentation in regards to how their system worked, and then of course that they had been going through some changes, assuming COVID, that they weren't using vans, so they took vans away, but they were trying to go back into that because the need, of course, was already there. So sometimes if they do let one of us know, we can send an email to the chair, the co-chair, and then that can also be.
Oh, sorry. I have a quick question, before I forget. So my question is this. So we had talked about, I know that I had spoken to Diana, I think we were at the last meeting, because since I know that Mrs. Olvin, your group focuses a lot on, the younger children, right? And
Everybody.
but I think that it's mostly, and what I'm seeing is, what are we doing for the kids that age out of the school system? Primarily in employment, right? And so that I had spoken to Diana, and the question is, like, how do we go about because that last meeting we talked about, when June was here, we talked about forming like maybe a subcommittee of people involved, like yourself and Carlos and Diana, and I mean, anybody else that works with the workforce, and like myself, that I'm in employment, to see about, building a subcommittee to talk about just employment needs and, the tax incentive that customers, employers can get. And, approaching that, and I know that.
I just wanted to add that that's a very viable idea. And one of the things I would hope, and we've discussed this years ago, is to include, like the Chamber of Commerce, representatives from Laredo College
Yes.
and the like, in order to create, like you say, a subcommittee, but a network whereby, post-grad outcomes are much better for people with disabilities, for the students who graduate with real vocational skills,
Yes.
real employability skills.
Yes.
So we need to have a better way, I guess, to build that bridge to be able to assess at least part-time work
Yeah.
that's appropriate to them.
Yeah.
So I didn't mean to interrupt, but I just wanted to put in a wind in your sails. I think it's a very important idea to bring forth.
Yeah, because I'm in employment, so I have access to a lot of employers, and so but I need not, how do I say it? Not backup, but I need like evidence. If you hire our people, these are your tax incentives, because I know when I've tried it in the past, and I don't want to get into it because I know it's in the meeting. This was just my question. Employers will be like, well, who's going to be responsible? And, what liability am I going to carry? And, So I feel we need to build on that, like a plan maybe, so that when we go before them, then we'll be able to say, hey, look, you get this if you help us with this. So, but the question again remains, how would I go about that? Like, how does that fit into the meeting? Do I have to do, is it a public comment, or how can we get that straight?
A lot of the issues starting with your concerns and yours, and as we go on. That's something we've been discussing, Dr. Wickinger and a number of us in this room, Diana, and Cecilia. And so that leads to the next item, that,
Can I just add one more detail regarding public comment, is that they also don't have to be present, they can submit their comment in writing to us, either through the members or, Angie, and there was something else. And yes, Ms. San Miguel brought a very good point that sometimes, the members are approached and then, it's discussed here, and the connection to resources or whatever they're struggling with, we would try to facilitate some of that. So like you mentioned, if it's with Parks and Rec, then we would connect with that leadership, or if it's whatever agency it is, either through the members or through us as liaison, we would connect with that and try to further the conversation.
And is there a statement that the secretary would read to the people that are going to do public comment about their behavior, about,
I think it's listed in, it's the clause, they're required, to notify members of their intent to comment, must be relevant, city business, and deliver in a professional manner.
We have one that says something about must be professional, anything attacks on committee members will not be tolerated, will be escorted out, and things like that. We have a lengthy one that I read every 6 months.
the two of us are saying, you don't have to even have that in writing. People who become rude and disrespectful, you can ask them to be good ones, because that's not, there's a professional, and meeting, being held, by the Robert's Rules of Order and things of that level, And so, if things get out of hand, you can very easily ask someone, I need you to step out because I think you're being disrespectful, or somebody, or insulting, and so it defeats the purpose of why we're here. We're here to try to develop solutions in a harmonious way, and somebody walks in, pistol whips you, it doesn't work, And so we're in a position where, as I've always thought of myself as a public servant, okay? And so I used to tell my employees, you need to tolerate a lot, okay? And I'm like, you know, when you come to work for our organization, you need to understand that you may be verbally insulted, okay? People are going to express things that you don't like. And those are things that you just need to smile and say, I will do my best to try to resolve this, okay? Because that's what we do as public servants, okay? And I'm not saying that you don't have a voice, but I'm saying that you need to swallow a lot before you
When it gets to
contradict them or you challenge them, and most of the time it's about people come to you for a reason. They're in need. They're desperate. Okay, they some of them have a desperate situation, and they don't know where to go and where to turn to, and so they come to different members or your employees that work for various organizations, and without you, people have no idea where to go, and so. As public servants, and some of you work for a private entity, but the bottom line is that you have an allegiance and to the general public about what is it that we do.
Yes.
Okay. And so I think that goes without saying. So okay.
So was there an answer to my question?
It was gonna be answered in the, because it goes into the next topic.
Yeah.
Oh,
That's what they were gonna.
So the discussion here is, and it's a discussion, possible action on the list of future partners, presentations, and pertaining to topics. Okay, so what we wanted to do was, we understand that there's been maybe 2 or 3 members of the health department that always share a lot of information. Okay, but that doesn't mean that they're the only ones that can or should be providing that information. All of us represent different organizations or different entities in different areas of need, okay? And so all I'm asking is that I think for us to continue that informative possibility where there's information sharing and there's training and okay, is that I know some of you work for, I know that you work for the Department of People with Disabilities, okay, I understand that. But you may have a whole lot more information that you should share, probably at least on a yearly basis. Some of us forget, and people probably are watching the public access channel and they're scrolling, and that's something that you could probably have, okay, receive. That you serve people with physical disabilities, okay, and rehabilitating them. Okay, and so we know it would become as a prestigious reputation in this community. Okay, so tell us what you're up to, tell us what you've been doing. Okay, all I'm saying is that we probably need to at least one of us, whenever we meet, has to provide us with information about their organization and what is it that you're doing lately. Okay. And again, I don't want you to write a super duper speech, okay? Because what we're trying to do is we're trying to train and educate each other as much as we can within a very short period of time. And typically what we had agreed on was at least 10 minutes or no more than 10 minutes, okay? I'm sure you can talk about your organization for 10 minutes, okay? That 10:01 will tell you again. But what I'm saying is that to address your issues, okay, there's people in this room that have a lot of information related to vocational services and job searching and employment and training, okay? Diana used to do that, okay? So Cecilia does that now.
Yeah.
Okay, so, but still Diana has a lot to contribute, so that's where that information that you were asking for, they're probably your best source, okay? Where you're finding that information. So it's sitting here on this table, okay?
so like I just approach them and build this?
Well, let me, I'm sorry, if I may interject, let me clarify. So the conversation that we had at that last committee meeting was to do a business symposium for what? We want to educate the employers, we want to talk about the tax benefits, we want to talk about, but vocational rehabilitation are the ones with a big bag of money and those resources and the subject matter experts.
Okay.
So so what we were waiting on was to hear back, right, regarding
you know, when could we do this? How could we do this? So that we could meet,
Yes.
right? And strategically put together a plan to bring those employers.
Yes.
So that's where I recall we left off, right, Marta?
So how would we get that started?
Well, I already shared that information with my management because that, of course, some information we as the BRC need to provide to them because they have their trainers, but
Right.
they want to know, they need to know specifically what dates are you looking for? Like, is it July, the month of July? Okay, is it a 1 hour presentation? So we ourselves also need to submit some of that information to them.
A request, in other words, a request for the.
So I told them, hey, this is in the works. The BRC is interested in maybe like a business symposium type of presentation for employers. Because yes, we participated in those before or where VR organized it and we invited the
I've been to
BRC.
those presentations.
Yeah, we used to have before, and this was usually around October, the Laredo Disability Alliance. We don't
At the
have that
college,
anymore.
Martha? You
That
go
was
there.
through VR as well, but then with changes and everything. But in you presenting, hey, I'm interested, what can we do to reach out? This is where we discuss and come up with a plan. Before, like some years ago, we were also reaching out to the Chamber of Commerce and we were trying to get our foot in the door. And they even came to give a presentation, but then I don't know, they had like a change in they usually have a change in management as well, and then that's where it ended. Because we're trying to, like on the employment side of VR, we're trying to address disabilities and employment. So we usually have several topics on the agenda. We're trying to work on different projects, but it just seems like last year what was very big was that we had the Autism Coalition being formed, and then when Miss Christine was here, all the outreach efforts that she had, that's why you've seen just mainly those two topics because they became really huge last year. They were doing so much so well. But we worked on parking reinforcement previous years as a project for the BRC.
The accessibility at the movies, at the mall.
The accessibility. So there have been a lot of projects that we've been working on or that we've worked on in the past. And but yes, maybe people don't know, but if you saw some changes, they were there because we put like our, our efforts were in that. But yes, for future, I know we do need to, and once a year, like by the end of the year, the beginning of the year, we usually say what are our items or what do we hope to accomplish this year. So we kind of set goals as well. But with some turnover, members leaving and new ones coming in, I think this is probably.
Yes.
So Mr. Adrian Zapata left the Chamber of Commerce?
No, he's there. No, he's
Okay, he just been running with that.
He's on,
To finish.
Yeah, because he came on, in October,
Yes.
and we bombarded him with all the data, so
I guess I was in the.
Yeah.
I have it here.
yeah.
and maybe for him to give us some kind of feedback where he's at, because he was gonna go look for some,
He was gonna do the modules.
he was gonna do the modules and he was gonna look for some employers that would wanna help us out.
Yes.
Yeah, but Mr. Leonard Jean Lindgren, I mean, he's the president of, he's the director of the economic development.
Yeah.
Yeah, like, well, he had they held a job fair on Friday of last week, and I spoke to him about it. I was like, Gene, like, you're right there. These are businesses looking at you.
Yes.
You're talking to these businesses. You're trying to attract them to come to Laredo. You're in the prime spot
Yes.
to help us with this. But he said he was going to look into it. He was, he's like, I'm spent. I'm everywhere, and I've got to. And I was like, no, I understand. I just wanted to start, planting a bulb because just there, guys. 2 people came up to me. Hey, do you have any jobs for my son? He just graduated, but he's autistic and he's having a hard time finding a job. So I'm thinking, wait a minute. So I got names down because I thought, yeah, I'm in the same boat. Like, not yet, but my son eventually is gonna. He's in there. He's gonna be there. So what are we doing for them?
So since professional services is one of the, I'm assuming the topic of priority at the moment, okay. Why don't we get that done as one of the very first things that we need to address?
Yes.
And then actually, I guess putting it as an agenda item to actually
Follow up.
have those efforts where we need to come up with a plan, then what is it a 1 hour presentation, and then to who, and that way that information.
So do you think that by next month you can get us some information as to whether your department can provide us that information or that training?
Well, that my supervisor has said yes, but we were just pending the last month. I wasn't able to be here, but what we need now is what do we want from that meeting, like the time, the hour, what invites that we can, so that we can coordinate that and get those.
So what would be the first step, a letter of request for that?
Maybe just like something short, quick to say that. It doesn't have to be like something extremely formal, but something where then as a BRC I can then take it back to my supervisor and say, hey, Ms. Luz, okay, this is what we're looking at.
Do we want to, because I know that some of those presenters may need to travel.
Yes.
So do we want to put a tentative date or a targeted date now so that when you go back to Dulce, right? Now, who do you want that email to come from? Do you want that to come from community? You want it to come from the BRC? How do we want to do this, right?
I think that's the BRC.
Okay.
Best. That
So
way they
I'll commit to generate that email to you.
Okay. No, thank you.
So they can get excited.
And I mean, anything I can do, I started already researching on the work opportunity tax credit. So I saw that unfortunately a lot of employers don't take advantage of it because they don't think that it's worth the 2,000 versus the risk of, discrimination, lawsuits, if you have to terminate an employee. And so that's when I thought, oh man, we need to group because just when we those two ladies that just the GDs, that looking for jobs for their autistic, adults. I thought, okay, if there's two right there, just in that, we need to conduct some kind of surveillance also on adults.
So there's a lot of adults and they have their degrees. But we're talking specifically, we're talking autism. There's a couple of adults out there that have degrees. The thing is that it goes back to socialization.
Yeah.
Okay, so that's where they get fired because of the social skills. And I believe I had already gone to the Workforce Commission and I had asked, work with socialization skills because this is what they need. And of course, they told me that they couldn't pinpoint it. They couldn't, for liability reasons, they couldn't do some things. And I said, well, just give socialization skills to everybody that comes into the workforce.
Yeah.
But we have a lot of adults.
Okay, so back to VR, they're getting back the money, they've got the adult program. And if they need that type of training, they need those supports, they have the contractors that give those supports. So these individuals need to be connected to VR, because VR is looking for those outcomes. The two outcomes are employment, retention, and employment, right? Those are the outcomes they're looking for. So if there are folks out there that you're aware about that are maybe needing some supports, have a diagnosed disability, that's vocational rehabilitation.
Right.
I would route them through VR.
But there's even jobs for individuals without degrees,
Absolutely.
Yes. Trade is the largest industry and everything's Amazon based style. So even if they can just put boxes together,
Absolutely.
there's opportunities for them.
Yes, I agree.
They don't need to be at home.
But I believe the answer here, and because I've worked at vocational rehabilitation in the state, right? I believe the answer here for that is vocational rehabilitation. They're at the table, they've got the money, they've got the county. They got a big bag of money. They do. And it's a shame because you know what? Every year millions get returned because we don't find the people. The people don't know. So this is why we advocate. This is why we're saying route them to vocational rehabilitation because they can help them with that diagnosed disability they qualify.
Okay.
And maybe I'm overstepping, but looking at it as the perspective of a potential employer, because we've been huge advocates of the summer earn and learn program and adult work, paid experience. I will share with the committee, and not to sound critical, I know we all have competing priorities. It's been very difficult to get to a person that can facilitate. Like, I am reaching out at this point for summer earn and learn, which we're already
Oh, we're
there.
yes.
And it's very hard to get an answer. I mean, I have to be there. Like, I wonder people, like, how many people can you give me this year? I can take 4. Like, you know, how can we start working? And it's like talking to the abyss. And it's unfortunate. I mean, I understand, you know, turnover difference, you know, in personnel. But we're ready, and I don't know how else. I mean, thank you for sending, you know, the message to your supervisors and your management. But like we really need them. We know of these programs. We know about the availability. I spoke to Ms. Hassel a couple of weeks ago. She was presenting all the services, and I'm like, yeah, I know. But like when we refer someone, or when we talk about our intent to collaborate, we need that follow through. So I don't know how to further engage
And I think at this point,
So where's the fragmentation happening? Is it the individual that's participating that backs off?
I feel like,
getting to somebody.
yeah, and with
That'd be awful.
where it's like, and then it's just like, okay, well, now what's gonna happen? Yeah.
And if I can share, it has been, this has been our hardest year due to Ramos left to San Antonio, and then we already, Mr. Joe Herrera is now our VR manager, and then Ms. Dulce moved on up to become our VR supervisor. So right now they have been kind of going through the trainings, and we did lose a lot of counselors and assistants, so we have been covering like a lot of duties. But to answer your question, yes, like we felt it internally before that everything's kind of like what's happening. SEAL is still happening. It was just shared maybe a month ago that this time around it's not gonna happen in June, it's gonna happen July, right, Carlos? SEAL. So now there's gonna be a change, and we don't even know how it'll work or how it will impact, because it was shared by state office that the summer and learn, usually it's us counselors that, okay, this customer would best be suitable at City Laredo as a receptionist because and we have a very specific counselor that even goes above and beyond, and Mrs. City, she even like says, okay, where do you live? She has a map in her office, and she's like, okay, you live in Mines, so it's gonna be far for you to go to the City of Laredo, right? Yeah, so she's even, and that's her on her time, like kind of, and then we present this information to our partners, which are Workforce Solutions, because for Summer and Learn, we're supposed to work with Workforce Solutions because they're paid some money to do most of these tasks.
And they have the employer base,
But,
right?
and they have an employer base. But what came down from state office was that we VR are not supposed to do any of that work, and it's only Workforce Solutions that we just provide the students and say, okay, we have these 31 students,
Where are you gonna put?
and you place them, you work on accommodations, that was just, we had that presentation maybe 2 months ago, and I know our manager was then gonna trickle it down to the board, and that's gonna be different, because what also came about on the viewer, Carlos, that they shared, okay, let's say the customer goes into their first day of work, and you employer notice that they're having difficulties and they're not behaving appropriately, you need to report it to the board, not necessarily to me, the counselor. Where before, it was, so everybody's up in arms right now with that, and for like the whole area, because everybody was doing it that way, but they're going back, but it's, the reason is that it's in their paid deliverables, and we're like, yes, but how will they reach the board? So, there's gonna be something going on, some change, it hasn't been shared, I don't think, with us, right?
No, just recently we got the amount of referrals that we have to provide, so that's the easy part for us as counselors. We know who we're working with, especially the students. It's once we hand that off, once we're passing that baton over to the other agency we're working with, Workforce Solutions, that's where you're seeing kind of things fall into the cracks, unfortunately. And the state, as Martha's mentioning, has been not removing a lot of authority that we can exercise, but they're letting us know, no, it's not on you, it's gonna be on these other agencies. So it's unfortunate, it's not something that we're looking forward to, but it's something that we need to.
And the participants ultimately need that, you know, availability of follow through and care and case management. So that's not an expertise that, let's say, Workforce Solution is going to have. This is looking at it from the outside. And the reason I was bringing that up is because based out of SEAL, my experiences, personal experiences with SEAL, going back to the socialization aspect, I mean, even the participants we had last summer, I had a participant that was like, I don't want to talk to people, put me in an office and file, I don't want to interact with anybody. And at the end of the 12 weeks, he was out doing outreach with Christine, giving out flyers and talking to people. So, I mean, it's just a matter of like,
They have to get, the environment you provide.
but then you know that participant is leaving feeling that comfort level. I see it with, you know, even full-time staff here. That they came in not knowing how to interact, not knowing what questions to ask, or feeling a little abrasive, and I would get those conversations of employees like, hey, like, what's going on with this? And I'm like, just wait it out, let's work it, you know, are they doing their job? Did they say anything disrespectful? Well, no, but they're demeanor, just work with it. Now it's like, he'll tell you about his day, like, how, you know, engage in a full conversation. And so, thinking about the need of socialization, I feel that's like low hanging fruit, like that those programs are.
And that goes back to when that individual has the need for a job coach, a job skill trainer that is assigned to them. That job coach will listen to what they want, and of course we report to the job coach. They want to be interactive. They just want to be fighting, and then the job coach will meet with them, and then she'll provide feedback, and then she'll let me know. You know what? I don't think he should be, just by himself fighting. Let's work on it. Let's try it out. So then that's how that improvement and yes, most definitely in some instances it doesn't work, but at least you tried it, and that's how you get then your feedback.
Okay, so we're not gonna sum up the issues of the.
Not right now, well, and then if you need any support as an employer that has seen the benefit of VR within these workforce integration programs, I'm more than happy to give testimonial or, report or anything like that. But you're right, we're kind of deviating, so.
So based on what you've heard, you tell us, or then you tell us what we need to do.
I'm doing the email.
Yeah, sure. Email in regards to CO, we'll go ahead and take it back to.
What can I do?
Then
Hang tight till we get back to you. I'll get back to you.
So that's gonna be one of the first things that we're gonna put on this agenda item.
Yes.
Okay?
Yes.
It doesn't mean that everybody else got off, okay?
For that, we can scale back our reporting as part of the city, to just give you.
That's fine.
Yeah, I think our focus needs to be,
Right now,
let's get these things
How intricate the information was, okay,
Yes.
it's got, there seems to be a lot of arms and legs to this
Yes.
problem, okay, or issue. And so that's what we need to work on right now, okay? And, that, going back to this specific agenda item, okay, that means that I do need participation from the DECAL, from UISD, okay? Well, you're already doing this. But, let's try to feed each other information or intellectually simulate each other about what is it that we do.
At the end of the day, what we're gonna need is, once we get to, let's say, okay, it's gonna be this date and this is the presentation we need, we as a committee still need to reach out to employers and say, okay, I'm gonna bring, I know so-and-so, manager, business owner, they're interested, bring them then to that presentation to have, of course,
I can help with that.
a good turnout, and then of course this.
We can
There's something to say about, again, I feel like I'm overstepping, but I kind of want to put it out here. I know the talk is of a symposium, which I think is of great benefit, but that's kind of like a one-point contact, and then people disperse, and then, wait until the next one. When you mentioned plan, I kind of envisioned some type of like written resource or document. You guys have your webpage still available, linked not only from our health department website, but also the city website, where you can put whatever, because you're right, the tax benefits are a little unclear for a lot, especially if you're thinking about like a small business. So if someone can delineate it, and maybe with the support of chamber, like the development and the disbursement of that information, there's something to say about that.
And that's where I struggled, because I went before them without a plan.
Yeah.
Without any documentation or so.
No, that would be bring the subject matter experts that be, which is vocational rehabilitation, right? Bring those subject matter experts. The idea is we're gonna educate, and we're gonna bring those stakeholders to the table, right? Hopefully we'll show up, right?
Yeah.
Let's educate those stakeholders, we'll bring the chamber, right? We'll bring Jean, who's on board,
Yeah.
right? And once we can educate them, then they can better educate, because you're not gonna have all that in one venue. Let's agree on that. But let's bring those important stakeholders
Yeah.
to the table, that we can convey this important information. And that way, when Jean is at the table with folks wanting to come to Laredo, we are an inclusive community.
Yeah.
Right? And we do have vocational rehabilitation and the Rotary Committee at the table, right? Supporting these initiatives. So we just want you to know, we're a long way from these huge cities, but we're making strides towards.
And that was the bottom line was, in my mind, obviously, as a mom of a child, of an adult, not with autism, was to build a more inclusive and diverse workforce in Laredo. Why can't we have that?
And then, of course, from that presentation, and what will happen is kind of like the trickle effect of people either wanting maybe a presentation for their own business, or maybe then future forming something. We mentioned maybe a subcommittee, a quarterly meeting, something where some of this.
And I think there's already a lot of adults, and we're not connecting with those adults. This will bring them out, because I'll tell you, I have a couple of.
And we want the recruiters at the table there, those HR, right?
That's me.
Yeah, that's who we need at the table too, because they're the ones that would be educated, maybe they have no idea, right?
Even not necessarily the owners, it's usually the
recruiters.
The recruiters, yeah.
See, all the important people.
If I may add, now, another goal that maybe we should also look at is recreational activities for all of the adults that are home.
Yes.
Because we have a lot of adults that are home, not necessarily adults with autism, just an adult with a disability. I think that the city of Laredo, the recreation department, can do so many other things that they are not doing.
Yeah, we're coming Erica.
No, I'm thinking, when I really approached some people and I had said, wait, Mondays and Tuesdays open the pool from 9 to 10, an hour for an adult that has a disability, not a swimming class, not just recreation. No, they don't have anything like that, not even in the rec center. Open the rec center. Yes, they have to be, because it's all about being a membership. Fine, let them have a membership, buy the membership, but let's have just a specific hour for them, because you have the city of Laredo has lifeguards on duty right now. What are they doing? No one's at the pool right now. So my thing has always been, open the pool, Tuesdays, open the splash pads. Just on a Friday from 10 to 12. And we're talking so that the kids are not gonna go, but the adults that are home are gonna go. Something easy, I mean, to me, opening a splash pad, it's like, okay, we'll open it and
for
see how. Yeah.
One example would be, for example, what you've done with the movie theaters, where you have specific hours just for individuals with autism. Because if you go to a traditional movie showing, It's really dark, it's
And
loud.
you know what, in all defense, I'm just gonna throw it out there, but we're advocating inclusion. It's not only gonna be for those people with disabilities, it's gonna be to include them in those community initiatives,
Yes,
right?
yes.
Because we're talking inclusion, we're gonna segregate them, that's not. So that's what we put the subject on that day, and our special invitation would be to those individuals with disability, do we agree?
Yes, and you know what happened, after we started doing the sensory movies at Cinemark, now Alamo Draft House does it.
Yep.
On their own. They just do it from us, and the parents are like, well, the children are at school. They do it on Fridays at 10, but it could be also for, the summer's coming, and it could be for an adult that needs sensory.
You can already see Ronnie there on there.
Definitely.
So why don't we, as a board and committee, talk to the, rec center directors and say, hey, what are we gonna do this summer for the folks? We know we've got activities going on, but how can we include individuals with disabilities so that we can also reach out to those families and let them know, hey, on this day they're doing this, on this day, because then you do all this, kicking up all this dirt, nobody shows up. So we're gonna strategically outreach community and let them know, hey, they're gonna have this event, they're gonna have that event. I don't know, how do we get the word out?
A flyer, I would say at that
No,
point.
I can ask Miss Stanley. Anita Stanley.
There used to be a community calendar.
Is a flyer.
Okay.
About that or not?
The community calendar, Dr. Rutinger's mentioned that there used to be one, she doesn't know if it still exists, but it probably should have.
I think they should share at the same room that is Parks and Rec.
Yeah, that's what I'm suggesting.
A flyer, and also going into the media, the news, you know, pages, and the reading one time with children is really helpful when it comes to,
Like they flash it at the end of the news or some community.
Yes.
Restart that somehow.
Yeah, and they have their public media, channel, also the city does.
I'm not shy to go to the media. It's okay, you guys just put it on the news here.
I'm sure, but I'll come on with you.
Okay, let's move on.
So we have a lot of ideas, okay, so we're gonna make them work.
Yes.
Mr. Chair, assign homework to one or two of the members to report back next time.
They volunteered already.
Thank you.
We have not that, and Ms. Odino's also as well.
Okay,
So, we've got more than enough people
Yeah,
we'll do it.
stepping up, so I thank you all for doing that. But we need to move on, if not, we're not.
yes,
We can
let me ask the.
So we're gonna move on to the next item. Report on family support for children and young adults with special needs program updates. Lizette, anyone?
Yes, hi everyone. I'm Kathy, but I'm gonna speak on behalf of Lizette. She didn't make it today, but she's the person who's going to be carrying of that project. Basically where Christine was latching on, she'll be holding those programs and keeping them alive. So right now she's taking the time transitioning, getting in contact with all of the partners, making sure that everything continues. But she'll be here in the next meeting to update you all. And I'm also glad that we're also having areas of interest. That way it also gives our programs where should we educate and outreach. So if we're talking about employment, that should be area that we should focus on too, and we can assist in that. So I'm glad that we're putting those areas of interest. And then for my program, which is the next agenda item, we're just surveying autism and other developmental disabilities. We're more on the data side, but we also do education and outreach. So we've been trying to navigate what do we go to, where do we go to. So I'm glad we found areas of interest. We'll be able to help you guys out from our project and provide that support to you guys. And we're also connected with the public information specialist here. So anything you guys need to be published out there, we go to events on a monthly basis. So we go to multiple ones a week. Anything you guys have, provide us the flyers, and we'll go out to the community and help you guys do that with our project.
So you can also you can tackle the surveillance on the adults?
The surveillance, we're only doing children, because that's our grant.
That's the grant.
That's
Right now.
Yeah, but we did have, a grant that they did apply to, which is for adults, so hopefully we did get that, so we're keeping an eye out to see how we can expand.
That's just how many are employable,
Exactly.
you know, and they would have that data too, but yes, you know.
To have.
Yeah, they're gonna learn, yeah.
Of course, and so yeah, we'll be working on that, and we'll be giving you our reports once we finish our surveillance for the year 2022, and hopefully that should be published by March 2025. Just because we have to kind of wrap up everything, but we're doing good so far. We already have enough partners that are feeding us data. We'll keep you all posted on that.
So the next item is, announcements.
I'm sorry, Mr. Chair, I had, unfortunately, when I'm calling, he's out at a conference, but just to clarify, so then, for the next meeting, you guys want an item on the further discussion for the symposium?
Correct.
Yeah.
With regards to the symposium?
Yes.
Were there any additional items?
Recreational opportunity.
Oh, when you stepped out, what was it, when you wanna figure what you were saying?
We talked about recreational opportunities and having the city of Laredo provide some kind of time allotments in the rec center, in the pools, in the splash pads, wherever we can go for those adults that are home. Adults with a disability that are home, that really don't leave the house.
We'll reach out to Ms. Stanley for her to maybe attend the next meeting, and you guys can have a discussion.
Yeah, that
It was
is,
my homework, thank you, Loretta.
have the organization plan it up for us to go out and seek out those individuals who would use it, okay, who use those facilities and those opportunities as well. So we need to,
We need to go to the news, we need to go to the media.
Create a flyer maybe after we have like.
the city of Williston has like a weekly schedule, monthly schedule or something like that, right? Or they use.
Community calendar.
They just rolled out a summer event schedule. I don't know what any of
But they have a very active social media page too, very active.
Okay, so I'll put those two items, or Angie, can you make a note? Yes, look for those two items for next month. Thank you, sorry about that.
Well, other than,
One, just real quick, I would like to encourage all of the members to consider providing some viable links for the resource page on our webpage for the City of Laredo Ribbon Committee. If we haven't revisited that for a while, so if y'all become aware of any links that might be for help to citizens with disabilities here in town, I really would appreciate if you submit them to Ms. Erica for possible inclusion in the webpage. Thank you so much.
Thank you, Dr. Finger. So if there's nothing else, then, can we adjourn?
Yes, and
thanks for trying.
Move to adjourn.
Jaime, Diana.
Yeah, that's it.
Vámonos.
Okay, thank you. Thank you for being here.
Thank you.
Thank you.
Thank you.
You.